Welcome to the Spine Care Expert Panel podcast. This podcast is an initiative of Spine Cloud International, which is a venture between Spine Care Partners, Spine Care South Africa, the Primary Spine Provider Network, and Spine Care Australia. Our aim is to fundamentally change the nature and structure in which spine care is delivered throughout the world. To this end, we've got experts participating in our podcast on a weekly basis who'll be shedding some light on this most fundamental and important subject. We mentioned in the previous podcast that we'd be looking at Scott Helderman's toolbox. And before we get on to that, I thought I'd just introduce one of our team members who's hard at work behind the scenes, producing a lot of the quality content that will be coming out. His name is Dr Kanwal Sood, and he just introduces his experience in Botswana with the World Spine Care Conference that we attended in April of 2016, the influence that had on him, together with Dr. Don Murphy's publication, Clinical Reasoning in Spine Pain, and the whole biopsychosocial approach to spine care. And then he brings in a very interesting part of the discussion, which is essentially what is a doctor being specifically a teacher. And we have a discussion on that. Over to Kanwal.
Thanks for that, David. So, as you mentioned, I'm a chiropractor here in Durban. I'm a chiropractor. I've been in private practice in Durban at a medical center in Durban for the past 8 years. And for the past few years, I've also functioned as a clinician, supervising 5th and 6th year interns at DUT's chiropractic day clinic. It's a role I really enjoy as well. And my interest in integrated evidence-based spine care and the primary spine practitioner model actually came about from spending time at the World Spine Care Project in Botswana in 2014. A good friend of mine, Dr. Tim Ford, was heading up the project there at the time.
He was appointed by Dr. Helderman, is that correct? Eh?
Yeah.
He trained at DUT?
Yes, he was slightly junior to me. And yes, I was excited as soon as I heard that he was going to be part of the project, and I felt it was a good opportunity for myself to spend some time in Botswana while he was there. The only problem is when you're in private practice, you can't spend that long. I only got to spend a couple of weeks. And
when was that?
That was in August 2014, and remember then I'd already been in practice, as I said, since 2008. So I'd been in practice a good few years already, and it was very powerful for me at that time. And
that began a transformation in your thinking. Certainly.
Yeah. And I felt, imagine if I'd had this exposure at the start of my clinical practice, so before I even opened up.
As we were discussing yesterday, it's kind of like it's the whole model of compound interest on investment.
Yeah.
Isn't it? You know, the earlier you invest, the more return you get later on.
Exactly.
And so that's why what we're doing here is we wanting to invest early into the minds not only of ourselves as clinicians, but of our fellow colleagues, those even ahead and those behind us. We want to pack our heads and our hearts with gold, good clinical, academic, practical, evidence-based gold, so that we get good returns on that in the future, and our patients greatly benefit, and we fundamentally see spine and healthcare change throughout the world.
I feel it applies to everyone, as you said, new graduates, patients, practitioners who've been in practice for a good few years, and anyone looking to grow in any way, and more importantly, offer their patients the best possible care, the best of themselves, and the best the profession has to offer. So exposure to this unique model and paradigm of care came about during my time in Botswana. Exposure to clinical reasoning in spine pain, the texts, as you said, the two texts they
Dr. Don Murphy,
yeah, and more importantly, exposure to chiropractors taking leadership roles in primary spine care, in community and hospital-based settings, as you pointed out, at the Jordan Hospital and in Chicago, the Mercy Hospital as well. I found it innovative. I found this approach certainly resonated with my management ideals, and straight away I actually saw it as harnessing the full potential of chiropractic and the true identity of the profession. And things became much clearer to me from then, actually. And I remember, as I said, I was a good few years in practice then, and it seemed like everything was coming together right then.
So it's like the coalescing of factors and the merging of tributaries to form a river.
Yeah, exactly. I felt it put into perspective everything I learned during my chiropractic education, and we learn a lot during the 6 years of training. It gave me better perspective on everything: examination findings, diagnosis, treatment modalities, everything. It transformed my practice. Improved my clinical decision making. It's given me a toolbox, which naturally we'll be coming to, more effective and efficient use of the skills I have as a chiropractor, and more efficient understanding and effective understanding of modalities and treatment approaches that are outside my scope of practice, and when they're needed. My understanding of outcomes assessment tools, imaging studies, diet, neural mobilization, McKenzie approach, intensive rehabilitation, NSAID use of anti-inflammatories, opioids, the use and indications for each of these, and more importantly, the evidence behind each of these and when each of these is required. And certainly much better overall appreciation of the biopsychosocial aspect of patient care. Yeah. Rather than the biomedical
and in a
model.
sense, that's a skill, isn't it?
Certainly.
I mean, we learn so many skills in practice. In education, we learn diagnostic skills, we learn therapeutic and manual therapy skills, we learn history-taking skills. But how much do we learn about how to handle a patient in a skillful way in a biopsychosocial framework?
It's touched on, but it's certainly not packaged. It's not enough.
Yeah.
It's not connected.
Yeah. Exactly. And often your skill and effectiveness in a biopsychosocial context will be based on who you are as a person. So your ability to help people, and I'm very deliberate on that word, because the World Health Organization actually launched an initiative called the Global Initiative to Advance People-Centered Healthcare. And they use that word very deliberately because they're wanting to create a mental shift in the world of healthcare, away from seeing patients as an object to perform a procedure on. What did you say yesterday about that?
Doctor. Doctor in Latin actually means teacher, not doer of procedures.
Yes.
And that's what we often get stuck in as clinicians. We focus it on what we do, on what we're able to apply to the patient. We make the whole process about that.
Yeah.
Not actually what the patients can do, and not actually on educating them on what they can actually do to overcome the conditions. So much more about what treatment procedures we can apply, how frequently we can apply them, and how often the patient needs to come in, and how important it is that the patient comes in to have those procedures applied to them.
Yeah.
Makes them almost a passenger in their care rather than an active participant.
Exactly. Yeah.
And that's so much that is so central to the clinical reasoning in spine pain and the primary spine practitioner model.
I want you to repeat that. What you said? Doctor in Latin. Give us the definition there.
Doctor means teacher.
Teacher.
Yeah.
And not
a doer of procedures.
Not a doer of procedures. And that's critical. And I think that's really lies at the foundation of what we're trying to accomplish here, is that we want to get back to basics, really. There are so many foundational elements to spine care and healthcare in general that a return to the fundamentals would accomplish far more than going down the rabbit hole, or the rabbit holes of procedures and techniques and etc. etc. And it really then foundationally relates to the Hippocratic Oath that we take in the beginning of our professions, even during our student years. And in the next part of this podcast, what we're going to be talking about is a little bit of an introduction to the biennial conference that World Spine Care has in Botswana, which we then both attended in April last year, 2016. And then we're going to discuss our conversation with the student, and we will tie all of that together and tied off with a nice big red ribbon. And that'll lead into the following podcast, which will be our discussion about Scott Helderman's supermarket of spine care services, together with the toolbox that he recommends we have a good acquaintance with. So we're going to just cap our discussion at that point, and to be continued shortly. We look forward to engaging with you guys. So thanks for joining us on the Spine Care Expert Panel podcast series. This is episode 2, and follow us on spinecloud.org for more information, and we look forward to connecting with you.